So everybody has memory loss, and we don't usually start to get worried about it till we get older. And so normal memory loss would be occasionally forgetting a name, occasionally misplacing your keys, forgetting a password, having to think about a little longer what day it is, but you remember it once you think about a few things. Abnormal memory loss, flags that you might want to look out for, is when those things start happening on a regular basis. So they're happening daily instead of occasionally. You start to get confused during normal, familiar tasks. Things that you've done frequently start to cause you to pause and have to think about it deeper. Forgetting the year or the current month is more of a flag than forgetting what day of the week it is or the date. Forgetting how to use a common object like a calendar, having to think about that a little bit, or a calculator. You lose things on a regular basis. Having difficulties with movement or problems with your sense of smell, interestingly enough, can be another flag. So if any of those sorts of things happen on a more regular basis, you probably want to talk to your doctor about it and get it checked out. A lot of people will find a lot of reasons why they're having that difficulty. So definitely family members can note that, and it's often hard for them to approach it with the person, but gently just noticing those things and saying, it seems to be happening on a more regular basis, and maybe we should talk to the doctor about it, because there might be a reason other than dementia that it's happening. And I think it could be imbalance, some type of imbalance in your body. It could be depression. It could be consistent alcohol use. It could be a number of different things that the doctor is able to pretty quickly rule out or be able to reverse if it's earlier on. Advantage to finding out what the cause of your memory loss is, even if it is an early dementia, there are many more options for you to treat or delay that when we catch it in the early stages. And by early stages, we mean when you start to notice that there's a difference. And even if the quick memory test they give you at the doctor's office, remember these 3 words, or remember this person's name and address, what is the date today, who's the president, all of those things, even if you're perfectly fine with those, but you notice that there's changes going on, you can tell that your memory is getting worse. That's really when you want to tell your doctor about it and potentially look at lifestyle changes that can delay or prevent further decline.